Hello and a very good afternoon to all of you. I'm Sayukta from beautiful Spotless Skin team, and I'm sure all of you must be doing good. This is June. The month of June is going on, but June is just not another month. It is also about acne awareness, and thus it makes this month of June even more special. So all of us must have gone through the phase of acne vulgaries. If not all, then at least most of us, especially teenage acne, adolescent acne. They are such big headaches because acne is just not about the appearance. It do impact the appearance, but deep down it affects our confidence level as well. Many a times people go into depression because they have this acne prone skin. They keep on having acne and condition. Plus treating acne is one thing, and treating acne scars, marks that it leaves behind is another. Thus, to know about acne, to understand how to manage acne, to understand how to prevent acne is very important. And for that, we'll be joined by our skin expert today, Dr. Ramya, a renowned skin expert heading from Bengaluru. Dr. Ramya N is a distinguished dermatologist with an MBBS and MD from Kempegowda Institute of Medical Sciences, Bangalore. She holds a fellowship in Aesthetic Dermatology from Rajiv Gandhi University of Health Sciences, KIMS, Bangalore. With 7 years of extensive experience, Dr. Ramya has served as a senior resident at KIMS, Bangalore, and currently practices as a senior consultant at Rangadore Memorial Hospital and as a consultant dermatologist at Venkat Charmalaya, Bengaluru. She is an active executive member of the Indian Association of Dermatologists, Venereologists, and Leprologists, IADVL, for the Karnataka chapter 22-23. And Dr. Ramya has contributed significantly to dermatological research with 8 publications and presentations at numerous national and international conferences. She is also a recipient of the prestigious ICMR Award for her research and has participated as an assistant investigator in clinical study trials. And we are just waiting for her to join us. Dr. Ramya will join us shortly, and then we'll start the conversation on acne. So, as I said, acne is so common and it's so troublesome. It's a chronic skin condition, and especially teenagers because there are hormonal changes. Then, adult acne in women are becoming very common because they are facing a lot of hormonal imbalance issues related to PCOD, PCOS, then menopause, and thus acne is common during adult as well. Then in pregnancy, many a times people get acne. Those who have a oily skin or a combination skin or a sensitive skin, they are equally prone to having acne than people who have this acne prone skin. It's so troublesome because, again, as I said earlier, it's just not about the appearance. Deep down, it also affects our confidence level. And thus, treating acne is very, very, very important. And to understand what to do and what not to do is equally important. It becomes very tough to keep our hands off our face when we have acne. We like popping it up, which is a big no-no because popping your acne can actually leave bad scars. Now, for scars and marks, you have various procedures. We'll learn more about them from our skin expert today, Dr. Ramya. And we'll also try to understand how we can, do a maintenance therapy once we have treated our acne because it's a chronic thing. It will keep on happening. So what are the preventive measures that we can take so that we can limit the formation of acne? So it's very important to understand how to manage acne, what should be the preventive strategies, and what we can do as the maintenance therapy. Another very important thing that we need to understand is what should be a basic skincare routine. Because there's so much of information these days, people are so much into influencers, social media, etc., reels and everything. And especially these influencers, they have so many, because they are also endorsing products. So they'll keep on endorsing products, telling us that this product can do wonder to us, that product will do wonder to us. And we end up buying like 50 bottles in the name of routine skincare thing. And but it's equally important to understand, are those 50 products going to do any good for our skin, or it's just that we are wasting our money, our time, and we are experimenting on our skin. Now, skin being the largest organ deserves some respect, deserves some focus to be given on it. So for that, we need to have a very good clarification about what to use, what not to use, what should be the basic, skincare routine. Because we all are busy, we hardly have any time, and thus it becomes even more important to understand that what can be a basic skincare routine with the minimalistic products that we can go for in a routine. So routine consistency is more important. So we will try to understand this point as well from our skin expert of today's conversation, today's discussion, Dr. Ramya. And we are just waiting because she is joining shortly. And then we'll start our discussion over how to take care of our skin, how to keep it acne free, and what to do with the basic skincare routine, how to keep it. Now, because I also have oily skin, and people who have oily skin have various questions. And here we go. We have with us Dr. Ramya. Very warm welcome to you, Doctor.
Thank you. Good afternoon, everyone. I hope everyone is doing well.
I hope the same. And Doctor, this is the month of June, which is also celebrated as Acne Awareness Month. We would try to, spread as much of awareness possible regarding acne, because most of us has gone through that phase, and as teenager and adolescents, we know how bad it was. And it's just not about our appearance. Deep down, it also affects our confidence level. Many times people who have acne-prone skin goes into depression. So it's very important to understand what to do, and more importantly, what not to do. So to start with, Doctor, with acne, what are the various types of acne, grades of acne, and why are acne formed?
Okay. First, I'll start what acne is about. Acne is basically an infection or inflammation of glands, that is the oil glands that are present in the skin. So everybody has oil glands, and they are present mainly on the T zones and on the cheeks and these areas, and they're also present on the chest and on the scalp and as well as on the back. So when these get inflamed and there is a super added infection on this, then you tend to have acne. So basically, acne is inflammation of pilosebaceous gland. And coming to grades of acne, so we have acne which are like a small bump which appears as a small bumps which are called as comedons, and then they go on to get infected and filled with pus, then it becomes a pustule, and then when the pustule is broken, and then it forms a nodule. So there are grades like comedons and papules, pustules, and inflammatory nodulocystic acne. So these are the types of grades of acne. And there are many types of acne as well. So like the acne which are acne conglobata, which are rare forms of acne. So these acne due to hair products which are called as pomades, and acne which are due to any mechanical friction, that is called as acne mechanica. So there are different types of acne based on the location and based on the history of the patient. We can tell what type of acne the patient is suffering from. So this is about acne. Yeah.
And doctor, many times we see various patterns. We see acne on our forehead, small bumps. Then we see acne in the butterfly area. Or else we see acne, on our neck, alongside the jawline. Do they tell us something? The location, the patterns, they tell us something?
Yeah, it could give us a clue on what you're suffering from or why the acne is because of. And so to summarize this on, if the acnes are there on the forehead, it could be because of gut issues. And if it is close to the forehead, it could be because of the hair products which are clogging the pores and causing the acnes. And there are small bumps that we see near the hairlines. And on the forehead, it is because of unhealthy poor diet and gut issues. And sometimes the acne on the cheek suggests that using the unclean makeup brushes or your pillowcases is very dirty, and then you're touching frequently, so that the environment and basically your practices tells about the cheek acne. Whereas on the jawline, on these areas and chin, suggests there is some hormonal cause for the acne. So these are the areas that can give us a clue of what the patient is suffering from.
Right. And doctor, there's such a common tendency of our society. We'll go for home remedies. We love applying something to our face, something to our acne, starting from, basin to clay masks to garlic to ginger to curd to turmeric to toothpaste. And then we go to over-the-counter, medication or topical application. And then we have so many influencers these days on various social media platforms. And skin health is something that is most of them's favorite, topic. They have something or the other. They have so many quick fixes. Now we fall for them. So my question to you is, do these home remedies, over-the-counter topical applications, products that the influencers or ways that the influencers are telling us, do they really work, or we need to actually go and consult the doctor at the very first place?
So it's very controversial. Some of the products might work depending upon the condition. If you have a mild acne, which is like a small comedons, simple exfoliation with a basin can do actually work. But then if you have a lot of acne, which is a nodular or inflammatory pustules, and these things doesn't work. In fact, it can aggravate the problem or cause irritation and lead to redness and irritation and burning sensation. So when you have a very severe forms of acne like a papule, pustule, and everything, so consulting doctor is a must. And using garlic, turmeric, and toothpaste, all of this leads to definitely irritation and post-inflammatory hyperpigmentation, which is another complication of an acne, which is very difficult to treat in an Indian skin. So treating acne is one thing, and post-inflammatory hyperpigmentation another thing. So these irritation can lead to post-inflammatory hyperpigmentation and also difficult to treat. So you should avoid these home medication in case if you are suffering from severe form of acne, and acne which is for persisting for a longer time. And I would suggest that you don't try all these things. Come directly to a dermatologist and consult and have a good skincare routine. And yeah, sometimes if you have a mild acne which is requires only a little bit of exfoliation, some of the basin and clay packs can work, but not garlic, toothpaste, and all of those things.
Hmm. Right. And then, as I told that, again, people are so, used to of going to a chemist shop that, I'm having these pimples, please suggest something. And those creams, those tubes, initially they work wonderful. I'm sure they contain steroids, and they work wonderfully on our acne, on our skin, and we feel that, see, we have found the way out. Only after a certain amount of time we realizes that our skin had become addicted to that particular cream. When we don't apply it, the acne aggravates, our skin becomes really bad. So what's your take on these over-the-counter topical application? Because it's a very, very, very common with me.
Yeah, as you rightly said, it's very common in India, and most of the acne aggravation and acne not responding to treatment is mainly because of these things. They go to a chemist and ask for acne or pimple creams. Some of them do give topical antibiotics, that is okay, it can work for some time. But if they give a steroid cream, then it is a problem. So most of them will contain steroids, and they keep on applying it. Initially, they feel very nice, and then they go on for a certain time, and then steroid causes thinning of the skin, leads to epidermal barrier loss, and leads to aggravation of the bacteria, that is the bacterial growth. And this aggravates acne and acne complication for later on, and they will have severe dehydration of the skin, and they become very sensitive to the sunlight and heat, and they'll start having red rashes, and that is when they come. And then when they stop it, they cannot stop it because the acne aggravates, and then their skin condition like the irritation, burning sensation aggravates, and then they continue using it, and finally they have to come to a dermatologist for repairing of that this thing. So you should be very very careful. If you want to get treated, you should go to a dermatologist, not use any steroid creams. Like even it's not just you go to a chemist, but there are people who are like in the social media platform also selling these creams, which are actually, you shouldn't fall for that, and it will damage your skin. Initially it might be good, but then later it damages your skin, and sometimes this damage is permanent, so we cannot really, if you have scars and all that, you will need procedures rather than treating with creams. So such things has to be avoided.
Right. So don't waste your time, your money, your energy, and most
Yes.
importantly, your health, your skin on these over-the-counter topical applications, creams, etc. Please go to the right person, which is a qualified dermatologist. A qualified dermatologist is where you need to go, and thus, of course, they'll tell you what is the problem and then get you treated. Now, doctor, when a patient comes to you, are there any tests that you normally recommend, or just by clinical investigation, you can say that, yeah, this is the acne, this is the grade, and probably this is the cause, and this is the line of treatment?
So most commonly, we don't write any investigation, or we do not require any investigation to diagnose or treat acne. But there are certain conditions where patients tend to have very systemic involvement, or they have a very severe forms of acne or a syndromic acne, which we'll get to know on examination and by patient history, or we suspect any other hormonal issues. Then we get the blood investigations, that is the hormonal profile and other adrenal gland profile and all of that, which will give us a clue of what the patient is dealing with. And then so that is the only time we require blood test or anything. Otherwise we clinically diagnose it and treat based on the clinical consultation. That's
Right.
it.
What are the treatment options available, doctor, for acne?
Okay. So, acne is a very diverse topic for treatment options. So, we have milder acne, moderate acne, severe forms of acne. So, when we are dealing with a milder acne, we generally give topical creams and gels to deal with it. Whereas moderate and severe forms of acne might require systemic treatment like taking tablets and and also creams and gels. So in case there is a mild acne, then we give face washes which contain salicylic acid, and then topical antibiotic creams along with azelaic acid for pigmentation and comedonlytic properties, and retinoids are a few of the treatment options that we have for a milder forms of acne. Whereas if it is from like a more severe forms of acne, we'll have to start the patient on oral antibiotics or isotretinoin, which is a retinoid, which is an oral retinoid, which acts on the oiliness and sebaceous gland of the skin and reduces the oiliness. So these are the oral medications that we give for a severe forms of acne. So these are the treatment option, and there are many treatment option, and there are treatment option for scars and pigmentation. So that those are the
Yeah, we would like
complications
to
of
talk about that also, doctor, because as you said, treating acne is one thing, treating the post-acne inflammation, pigmentation, scars, spits, it's another, and it's more challenging. It's looked like more challenging. So what are the
yes.
procedures? What are the treatment options for treating these scars and marks?
Okay, so for acne scars and marks, we have procedures ranging from chemical peels, which are basically exfoliating procedure, mainly focused on milder scars and pigmentation. Then we have treatments like MNRF or dermarollos for acne scars. There are many types of acne scars like ice pick scars, rolling scars, and box scars. They are basically of different depth and different configuration. So based on that, there are different treatment options. So we have MNRF, and we have carbon dioxide laser that we do on patients with acne scars, and we have laser toning for acne pigmentation as well. So these are the various procedures that we can do for acne scar and pigmentation, and it is always tailor made for the patient depending on what type of scar and what type of pigmentation they suffer from. Yeah.
Fair enough. Especially because teenagers, they go through that phase. Hormones are changing and their body changes, and then they have acne and all. And they are always wondering what to do because they want to try and find out a routine, rather, a skincare routine, which is basic and they can stick to it because they are equally busy. They have their studies, they have their life mottos, etc. But they want that minimalistic approach, something that they can be more consistent with. So what can be a routine, a basic skincare routine that we can go for, doctor?
So basically, we are talking about teenagers here. So teenagers, even if they're suffering from acne, but their skin types are diverse. Like some can have sensitive skin, some can have oily and a dry skin. So in such cases, based on the skin type that you have, you can use a mild cleanser. Mild cleanser is a very important thing that they have to use in their skincare routine. So basically, to wash away all the dirt and pollution that they get exposed on going out, and also oil secretion from their face. So based on their skin type, a gentle cleanser is a must. That is the basic routine they should follow. And after that, a moisturization is also an important part of the routine. For an oily and acne prone skin, they should use a gel based light moisturizer which is non comedogenic. So you can see for these things on the, like if you're going for like purchasing a product, you have to see these keywords, like they are light, non-comedogenic and gel based. So that will be good for an acne prone skin. Whereas if they have a dry skin, then a light moisturizer which can be a cream based, which is non-comedogenic, can be used for people with dry skin. So that is one more thing. And then sunscreen also should be added for the people with acne. So there are many acne sunscreen that are available in the market now. So they are all lightweight and non-clogging and non-comedogenic and water resistance, wet resistance. So these are the keywords that they should look on a sunscreen, and that is one more product they should have. And also in the night, they should always use a cleanser to cleanse the skin. And if they're using any makeup also, they light I mean, for a teenager I wouldn't suggest them to use a makeup, but in case they're using, they have to use a lightweight non-comedogenic, and then cleanse it off before they go to bed. So and using a light moisturizer again in the night is a very important step in the night as well.
Right. So this is a very, very basic minimalistic approach for a skincare routine. And can adults go for the same? Especially people who have acne-prone skin, oily skin, sensitive skin.
Yeah, definitely. So based on the skin type, they should have a basic minimum. Everybody should have a cleanser, a moisturizer which is suiting their skin type, and a sunscreen. These are the basic skincare, pack whatever creams that you can have in a routine. So be it an adult, be it a teenager, you should have such things in your routine.
Right. Now, people have so many doubts. And like many times, people who have a oily skin or acne-prone skin, they'll say that probably I have a dirty face. Probably, because my skin is producing so much of sebum oil, that's why I'm having acne. So they keep on washing their face. And again, we have this tendency, we love those cleansers, face washes that have more foam, leather, that forms a lot of leather. So, what is the right way to do it, doctor?
So, excessive cleansing is not good. Even though you have oily skin, excessive cleansing leads to dehydration of the skin, and chronic dehydration can lead to barrier dysfunction. And when there is a barrier dysfunction, infections, that is the Cutibacterium acnes infections, are more common. So you will have more acne. So, excessive washing, even if your oily skin, is to be avoided. And also choosing a right cleanser which is pH balance is also very important. So we these as you said, that foaming cleansers which are like very they give you that fresh and dry feel. Those cleansers will have acidic pH which dries your skin. So those cleansers has to be avoided, and pH maintained cleansers has to be used. And definitely you will find many options. When you have to search for it, you will get that. So avoid this foamy cleanser if if you have a very dry and sensitive skin. But if you have a oily skin, you can use a foaming cleanser now and then for cleansing. That is when you have a lot of oil secretion. So that time you can use a foaming cleanser which is pH balanced, not alkalic pH cleanser. But a pH balanced foaming cleanser can be used for a oily skin people now and then. But for a sensitive skin, but always use a non-foaming gentle cleanser which is pH balanced. Yes, and excessive cleansing is not an good for oily people.
Right. Now with moisturizer, people have the same kind of say, because my skin is already producing so much of sebum or oil. Do I really need a moisturizer? And that's why they skip that moisturizer part.
Yeah. So recent studies have pointed out that acne, even if it is a comedon or a severe forms of acne, they will have a skin the barrier dysfunctioning. So when there is a barrier dysfunctioning, you need to use a moisturizer to protect that barrier, protect the skin from getting infections and other environmental exposure. These barrier dysfunction is one of the causes of acne in the recent studies. So people with oily skin also have to use a moisturizer, and but they have to use a moisturizer which are suiting their skin, like a light gel based moisturizer. So that will help in repairing the barrier.
And what about sunscreens? Because people have so many complaints about sunscreen. They don't like the white cars. They many a times they make them sweat. They don't like the dull, patchy, effect that they get. And plus, when we go to buy a sunscreen, there are so many informations, written on the tube, on the box containing the sunscreen. So, what are the basics to go for? What are the things that we need to check before we buy a sunscreen?
Yes, sunscreen. Many people find it difficult to find a suitable sunscreen for them. They'll have a lot more complaints about sunscreen, like you told, it leaves a white cast, and they have that oiliness after applying the sunscreen. Yes, but there are sunscreen which are for acne skin patients. They are like silicone based, matte finish, and these are the sunscreen they have to look for. And also sometimes a gel based sunscreen also would be good for a patient with acne skin. So sunscreen, what you have to look for is it should be non-comedogenic, that is do not form comedons when you have applied, water resistant and sweat resistant. So these are the things that you have to look for in a sunscreen. And also in a people with oily skin, they should look for something like a matte finish or a silicone based sunscreen, which will give them that matte finish and no white cast kind of a thing. So there are many sunscreen which are available with these labels. So you have to look for these keywords in these sunscreens.
Fair enough. Now, Doctor, we often associate acne or pimples with our diet. We have heard people saying don't drink milk or don't have dairy products if you are prone to acne. Don't eat fried or spicy stuff. So, we would like you to shed some more light over the dietary precautions.
Yes, diet has a very much impact on the acne. So oily and fatty foods or high fat diet definitely leads to acne. And so the like the many studies which have conducted that the skim milk or a high fat milk does it cause acne, but there are no substantial evidence to prove it. But in a regular consumption of a high fat diet which includes fried items, chocolates which contains excessive sugary items, and definitely sugary drinks like coca-cola and other stuff are known to cause acne. So these are the things that you have to avoid in your diet. Definitely it causes an increase in your acne and also increase in your sebum production. So tend to avoid these products in your these food in your regular diet. So shift to low fat diet and protein rich, low inflammatory, that is anti-inflammatory food, which will give a good glow and acne reduction in your acne reduction.
Absolutely. And doctor, what is a maintenance therapy? Once we are done with the treatment, how important role the maintenance therapy plays?
Yes, acne as such, it's not going to be like, once you're done, it won't come back. Acne is a ongoing condition, so maintenance is very
Mm,
important. After you're done with the treatment, you've controlled your acne breakouts. But if you don't maintain it, it can come back very soon. So maintenance is very important. So in such patients, maintenance regarding their diet, their lifestyle, and also the skincare routine has to be advised, and they should follow that in if they don't want to have acne back again. So basically they have to avoid this high fat diet, sugary items, and pro-inflammatory foods in their diet. And also stress is another important trigger for an acne, so avoid anything that causes stress, like exercise. Stress management is also an important lifestyle modification that they have to do in maintaining acne. And also the cleansers, like we said, there are products that they have to use post acne breakout as well, like cleanser and moisturizer, sunscreen. And these are the must in their routine even if they finish the acne treatment. And also they have to follow these precautions, like changing the pillow covers, cleaning their makeup brushes, and also
mm,
cleaning their phone cases. And yeah, so double cleansing in case they're using heavy makeup products. So all of that has to be followed to maintain the skin.
And doctor, these days market is flooded with products, in the name of skincare. We have so many products. Influencers at the same time are endorsing so many things, and we end up buying so many products in the name of skincare. And we are also, keep on changing them. We are experimenting a lot. For maybe 1 month, I'm using product number A. Then for the next month, I'll use the product, B. And the number of people with sensitive skins is also rapidly increasing. So my question to you is it a good idea to experiment with your skincare products, the brands, etc., or we need to stick to few things?
Definitely, if you have a sensitive skin, I wouldn't suggest you to experiment with the products, because obviously sensitive skin, you are more prone to have reactions to each and everything. And sometimes you will not know what are the what are the actives that are there in the products. So experimenting is no. But if you have but it is better to always go and consult a dermatologist to know what suits you, and then follow that. But there are like concerns that keeps changing, like sometimes this summers you might deal with acne, but then later on it will be like acne pigmentation. So sometimes as a dermatologist we do change the products depending upon what condition you have. But we do change it because you have a different condition, different problem that occurs later on. So in that case, yes, based on what concerns you have, you can change the product. But without anything, just to try products and then end up having irritation, that's not a good idea. But to have that depth of knowledge, like what can be the right product to use right now, you should always go to a dermatologist or read about it extensively if you have a normal skin, and then do try experiment. But I would suggest, yeah, go to a dermatologist.
Right. So in case you have doubt what to buy, what not to buy, which brand to go for, go to a dermatologist. They'll help you as per your skin type, your skin condition, as per your working environment, etc. Now I'm having so many questions, from our viewers. A very regular thing that people who have acne do is to pop up those or squeeze those acnes, or it becomes really tough for them to keep their hands away from their face or from their acne. Why it is important to not pop the acne and do not touch your acne.
Yeah, so popping your acne, that's a specific condition called as acne excori. That's a very common problem with the teenagers. They cannot deal with this pustule appearing. They just go and stand in front of mirror and they pop it. But what it does is it will lead to more spread of infection and also post-inflammatory hyperpigmentation. That is one of the important side effect of popping your pimple, and that becomes very difficult to treat. And so never pop your pimple. That's one of the important thing, that if you're dealing with acne, that's one thing that I would say no.
Okay, so we have Pooja, and her question is: do I exercise regularly for acne management? Does exercising, physical activity, they all help?
Yes, if you are exercising is one of the method of managing your stress and also reduction of weight and keeping your hormones under check. So exercising does affect your acne management. So definitely exercising is an important thing for maintaining. But there are precautions that you have to follow during the exercise, like when you're exercising, like if you're sweating too much and there's a lot of oil production, cleansing post exercise cleansing is also important. If you leave it like that, excessive sweat can also trigger acne. So avoid that by using a right cleanser and cleansing post exercise, and also wearing a loose fitting well aerated clothes. Sometimes people who exercise a lot tend to suffer from back acne because they wear tight clothes and they sweat, and this they are not the clothes are not breathable, so that leads to pore clogging at the back, and then they'll have a infection and then back acne. So cleansing and wearing a good a breathable cloth, cotton cloths, is important if you're exercising. But do exercise when you're having acne, because as I told you, it helps you maintain your hormones and also keeps your weight the hormones under control. Yes.
Okay, we have so many questions, but most of them we have discussed already. So one last question that I'd like to take is Bindu Shree's question. Best face wash, please. Doctor, without taking the name of the brand, if you can just tell what to look for in their cleanser once again.
Okay. So, face wash, what to look for a oily skin, then you can go for a salicylic acid based face wash. Whereas if you are having dry skin, anything like milder, like a mandelic acid or a mild cleanser can be used for a sensitive skin cleanser. But if you're having a oily skin, yeah, salicylic acid based cleanser can be used.
And before we wrap up, Dr. Ramya, any take-home message for our viewers?
Yeah, so acne is not just a simple zit that you experience now and then. Acne can be a problem deeper than that, and also taking medications from thinking it's just a zit and go buying medications from anybody and having a problems later. Do visit a dermatologist, get a personalized treatment and personalized skincare routine so that you can manage your acne and have a good skin. So that is my take home message. And then have a in-depth knowledge, go discuss with your dermatologist, and then they will definitely give you a good routine to follow. Yes.
Absolutely. Thank you so very much, Dr. Ramya. It was wonderful talking to you. Thank you for taking out time for this conversation, this session, and thank you for making this session so informative. Thank you once again.
Thank you. Thank you for all the viewers. Thank you.
And viewers, thank you for your excellent participation. Stay happy, stay healthy, keep smiling, and stay focused. Have a good day ahead.